And I just briefly want to just again give welcome you all to the Mental Health Association Community Touchpoint virtual session. This is the first one that we've had. We're going to be doing this every month for even after I leave MHAAC, so that we can really build the presence of MHAAC, and we can ask for funds that we need, and that we can ask for volunteers. And then if people need services, every single person here is passionate about mental health, myself included. And it's going to take the village to get MHAAC so it's completely sustainable and the services keep expanding. So that's the purpose of the work that we're doing, Kathy and I, and that I do. So thank you all for coming. I briefly just want to acknowledge Francis, Joe, Liz. I'd like to acknowledge Millie. And I'm trying to see everybody. Okay, I've got to change to gallery view, which Patty was talking about. There we go. Yes, Patty, you're right. Way better. Okay, so I need to acknowledge our board members that are here, Liz and everyone. And then I'd like to acknowledge Leslie, who is MHAAC staff, who's just absolutely a pleasure to work with. And then I'd like to acknowledge all of our panelists who, I don't do what you all do, but I know you're pretty phenomenal at what you do. Charnice Jones, Francesca, I don't see your last name, Francesca, Beverly Bergman, and then Patty, who I had one meeting with this woman and I was like, I got it. We need her because she's so amazing. And I knew that she'd been on our board and had been an incredible champion for the organization. So I want to acknowledge Patty. And I want to now toss it to Chris Willmore, who is a board of directors member who has just really stepped up and is really someone that's going to help us take MHAAC to the level that we want to, specifically in the fund development department. So I am tossing to you, Chris. Thank you so much.
Well, thank you very much, Jackie. Good afternoon, everyone. Yes, I'm Chris Willmore, and I'm a longtime Bay Area resident. I've lived all over Walnut Creek, Berkeley, San Francisco, Redwood City, Sunnyvale. And then for the last 3 years, I've lived here in Alameda with my family, including 3 kids. A few years ago, when I was working at Slack, I joined an internal chat forum that was focused on mental health discussions. And at the time, I was going through serious depression, and hearing how others face their mental health issues gave me a lot of hope and comfort. One day in the forum, a colleague who also serves on the board, she put out a notice that MHAAC was looking for to expand their board. Now, recognizing I had no idea what the role entailed, no experience in the mental health world and nonprofit organizations, I took a chance, got to meet some of the folks here, and had the privilege of joining. Now, having learned firsthand the value of mental health services and recognizing that our society clearly needs much more support, there's a huge portion of the community that's underserved. I really felt a strong need to do something. It has been amazing being part of MHAAC over these past, I think, 2.5 years now. The group has a wonderful sense of vision, execution, and above all else, dedication to the community. The work, which you're about to hear about today, plays a vital role for the health of our communities. I'm so glad you're all here today to learn more, and thank you.
Thank you so much, Chris, for that. And we are very lucky to have you. Having board members that can show up in any way that they can is critical to the work. Sometimes board members donate, sometimes they just give time, they give expertise. So thank you. The next thing I want to do is introduce Kathy Davies. Am I saying it right, Kathy?
Davies, yep.
Kathy Davies, who's our executive director. Yeah, Kathy is a powerhouse, and she is helping to move MHAAC into the next century for expansion and sustainability. Kathy's going to talk about the Mental Health Association of Alameda County's mission and vision, She's going to talk about really the sorts of problems and challenges that our organization addresses, the solutions and the programming to a little bit. And then I'm just going to show a brief video that goes over what our programs are. So I'm going to pass it now to our Executive Director, Kathy.
Thank you, Jackie. So I love talking about our mission and vision in part because I like telling the story about how we got there. So back in the before times, in January 2020, we all met in person, all being the entire staff, and we did an exercise involving large pieces of sticky paper all over a very large conference room. And everybody took time to write down the values that were important in their work. And then they were given so many pieces of sticky paper and said, okay, mark the ones that are most important to you, three to five. And so from there, we created our values, which are respect, integrity, accountability, and teamwork. And then from there, with all these thoughts and ideas, I drafted our vision and mission, and I sent it out to the entire organization for comment. And then, of course, it went to the board. So our vision is that people with mental health challenges and their family members will be free from stigma and provided the support and services they need to thrive. And our mission is to empower adults and youth with mental health challenges and their families to live their best lives. We do this through education, support, advocacy, and shared experience. We provide client and family-driven services delivered by highly trained, compassionate, and committed staff who share that belief, the belief that recovery can and does occur. There's a lot packed into those little, couple of statements that I think are really important to the work that we do, and speak to the next question that Jackie asked me to talk about, which is, what issues are the agency seeking to address? And when you reflect back on our vision and mission statement, again, we would like people with mental health conditions to thrive. And in order to do that, they need access to services and support. And so that's part of the work that our staff does is help people get access to services that they need. And then the issue of stigma comes up. And I think that the work that we do addresses stigma in a huge way, because a large portion of the work that we do is delivered by folks with lived experience. People like Chris, our board member, who's willing to step up and say, I too have a mental health condition. And the more that we tell our stories and the stories of our loved ones, the less power that this idea of stigma has. So, thanks.
And then Kathy, the other question was, do you want to talk a little bit about I'm going to show the video, but I'd love if you gave context to what I'm going to show, which you're familiar with, obviously.
Sure. Okay. So Jackie's going to show, again, as she said, a video that briefly highlights the work that we do. And let me describe very briefly the work that we do. So again, part of the work that we do is represented here through the Patients' Rights Advocacy Program. We remarkably have been doing this work almost 4 decades. Pretty remarkable when you think about the longevity of that work. So you're going to hear quite a bit of the Patients' Rights Advocacy Program. So I don't want to spend a lot of time talking about that, but we do this work in Alameda, San Mateo, Marin, and soon to be Sonoma County. We are expanding into Sonoma on October 1st. The rest of the work that we do, which is actually also represented here, is family support oriented. And that's the work that Bev does, our family caregiver extraordinaire. No one supports families like Bev. But we do the family support work also in the Family and Education Resource Center, We do the support work as well in our family partnership program and also in the African American Family Outreach Program. So, thank you, Jay.
Thank you so much for that, Kathy. I'm going to share my screen now, and I'm going to, one moment, everyone. Okay, can everyone see this here?
Sure can.
All right, so I'm going to start the video, and I'm going to pause it at times for advocacy, hope, and support are really the pillars that the work that the staff at MHAAC do, that is public facing, that is working in the office, and that myself, facilitating advocacy, hope, and support for our clients and for our clients' families. We serve Alameda, Marin, and San Mateo counties. And Kathy, I don't want to miss any counties. Is that everywhere? Contra Costa, right?
No, we're not in Contra Costa.
We're not. Okay.
Contra Costa. So,
Okay.
You're right. Alameda, Marin, and San Mateo, and soon to be Sonoma. Soon will
Okay.
soon will be in Lime Tree.
Awesome. Okay. Thank you. So FERC, Family Education and Resource Center. This is a family caregivers centered program. We work with family caregivers of children, adolescents, adults with mental health conditions who live in Alameda County. I don't know a lot about this program, but I know it has an extraordinary reputation. And I know that we will be doing a community touch point where we can share more about all of the programs. But that's FERC. I do want to toss to you really quickly, Kathy. You told me that FERC was one of the only, it is the only something. Can you share that with the collective?
Yes, it's the only, by reputation, now I haven't driven all around the state of California to verify this, but by reputation, it's the only family resource center specifically designed to support family caregivers in the state of California. So there are other family resource centers in the state of California. I used to operate a handful of them at my last job in Contra Costa, in Stanislaus, and in San Francisco. But this is the only one of its kind by reputation that supports family caregivers for family members who are supporting a loved one with a mental health condition. So
thank you, Kathy. I will be tossing to you again, probably. And the Patients' Rights Advocacy Program is another program. This is centered on mental health patients. We're going to be, everyone here is working within that program and has tremendous amount of experience. So we're going to circle back and we can talk about all of that when we get to our panel discussion. The African American Family Outreach Program centers working with African American caregivers that are that are caregiving for their families. It is the backdrop that our executive director has. And I know that this program was really pushed by the organization within itself, and the support just was not there. Next program, the Family Partnership Program. This is a program that Allison heads up. We're actually the next community touchpoint program that, community touchpoint virtual session that we do will be with Allison and her team. This is an extraordinary program because it's helping parents who are trying to figure out how to navigate the mental health system with their children. And there's all sorts of support, and there's actual education and training that happens within that program. And again, I'm giving a very general, brief overview as the fund development department who's passionate about making sure these people can keep doing what they're doing. But I don't know all of the ins and outs, which is why we're going to be doing sessions like this. the mental health grievance, let me go back. The mental health grievance assistance, that is centered on mental health patients as well. And then the last one here is the Family Caregiver Advocacy and Support Program. And
That's bad.
Kathy, that's Bev. Great. Thank you, Kathy. So that was just a brief overview of the programs. And again, I don't know the ins and outs of all of those. I just know that this is critical to the work that we're doing within the community. I've worked with nonprofits for a while, and I consider, from my viewpoint, MHAAC a community-based organization. They're really in the community helping people who wouldn't necessarily be helped. And with that, no further delay, we are now going to go to our panel discussion. I'm going to pin everybody in our panelists. And Patty, if you feel like you would rather see everybody, let me know. Let's see.
No, I'm good. However you want to do it. It's all good.
Okay, so I'm adding another pin. Okay, so these are our incredible panelists, and I'm going to have everyone introduce themselves. I'll start with you, Sharnice Jones. If you could, Sharnice, just tell us what you do within the organization and give a little context, every day, the work that you're doing. To share your role and your work within the PRA program. Sharnice Jones.
Thanks, Jackie. Hi, everyone. As Jackie mentioned, my name is Sharnice Jones, and I am the director of our Patients' Rights Advocate program. I oversee all operations of the PRA program, including certification, review, hearings for patients who are involuntarily detained, and locked treatment facilities, as well as capacity hearing processes. And capacity hearings are for individuals who are involuntarily held and are objecting to medication. And I oversee those processes in Alameda County, Marin County, as well as San Mateo County.
Thank you, Sharnice. And I'd like to toss to Bev, who is really just blows my mind. Go ahead, Bev. Go for Bev Bergman.
I'm Bev Bergman. I've been working for the organization for 29 years. It's a great place to work. I've been a family advocate for the last about 14 years, working at John George Psychiatric Hospital in the lobby, talking with families and consumers. I can go on if you want me to go on, but I can talk
Thank you, Bev.
later. Thank you.
Yeah, we'll circle back. Thank you so much, Bev. Bev is working directly with our clients and the families, which is just amazing. And Francesca, who has worked in direct services, she's also worked as administrator, has a breadth of experience and a deep passion for this work. Francesca, please share your role. Let me make sure I have the right question. Please share your role and your work within the PRA program.
Hi, I'm Francesca Tenenbaum, and I am the Director of Patients' Rights Advocacy and Training. I've been working with Mental Health Association for 26 years. For much of that time, I was directing the Patients' Rights Advocacy program, and really exciting to have Sharnice come in and freshen up our program. What I do now is a very specific aspect of patients' rights advocacy. I have a team of monitors and investigation specialists. We investigate complaints from patients or family members and do monitoring of the facilities in Alameda County. And that includes providing consult, education, training. Basically, that's it.
Thank you so much, Francesca. And then I'd like to toss to Patty, who is was a former board member, but is a champion for our organization. And Patty, I know that you work in conjunction with PRA. So if you could just answer that question about your role overall.
Yeah, sure. So I have the privilege of, I get to see Sharnice and Francesca's teams in action, and I get to see Bev in action. working with families in our lobby. So I'm I've worked in mental health in the acute locked inpatient setting for over 30 years, but most recently, I'm the chief administrative officer at John George, which is the county safety net. So we see about 10,000 patients a year coming through our psych emergency. So and anyone who gets admitted because they meet criteria, like the level of their mental illness is so much that they're a danger to themselves or someone else, or so confused that they could hurt themselves, they can't care for their own food, clothing, shelter, then they'll get admitted. And so I'm not involved in the work that PRA does in any way. The county works with MHA to essentially, they have a contract with them to provide this service, which is required by the state, that patients' rights are respected. And so anyway, we'll say a little bit more, but basically it's a really collegial relationship that we have, because if we didn't have patients' rights, we have the people that come here need to be protected, and to make sure that they get a fair hearing, because the great majority of people that come here are here against their will. So it's nobody wants to be locked up. So it's, we need to really make sure that they meet the criteria for being here.
Okay.
And so anyway, I just appreciate the level, and I'll say more about Bev and the patient's rights later if we have time.
Yeah, absolutely. Thank you, Patty. So Charnice, as the program director, could you please give an overview of the PRA program and answer this, in context to how you want to answer it?
Sure, I can speak to that. So the patients' rights advocacy services are provided to mental health clients as specified by Welfare and Institutions Code and Title IX of the California Code of Regulations. And that's a very long-winded way of saying we follow letters of the law, and we ensure that individuals who receive mental health services at licensed mental health or community care facilities are notified of their rights. As Francesca touched on, we monitor the compliance of programs and the facilities with statutory patients' rights provisions. We also conduct investigations of complaints, and Francesca mentioned this as well. We provide training to mental health facilities and service providers to update them on patient rights too. We also serve as a liaison between facility members such as Patty and her team to work collaboratively with our facilities to ensure that patients are aware of their rights. I would say that'd be our main focus for our patients' rights program.
Okay, thank you so much. And so I want to segue to you, Bev, because you're working in the facilities, you're working with clients and their families. And the general question is, working one-on-one with clients and their families, what does that require on a day-to-day? What does that look like for you? You can expand on that, Bev. We're just trying to get an understanding of literally what you're doing as the person that's doing the work.
Sure. I'm situated in John George Psychiatric Hospital lobby, and I interface with families and folks requesting mental health services in the lobby. I try to educate, support them, try to help them navigate the system, and make connections if needed to social workers and other people that can help get the information to the doctors about the person's mental health history and medications and different things that are important for them to get the treatment that they really need. A lot of folks come up there that their loved ones have been in crisis for probably many weeks and probably months before that they get hospitalized. So they're somewhat relieved, and I try to talk with them about what the reality is, that it's stabilization, it's not a cure, that this is not a sprint, it's a marathon, basically, that mental illness is pretty episodic and people can get better and then sometimes they get worse, but we'll always be there for them. Our organization has lots of advocates, patients' rights and family advocates that will be there for them, no matter if their loved one's in the hospital or out. We're always there for them, and we have ongoing support groups and different educational events for them too. So I try to kind of demystify the whole thing, because some people, the first time their loved one is ever seen by a mental health clinician is in the hospital in a crisis, like a young person having a psychotic break for the first time. And it's like jumping in at the deep end of a pool for parents because they don't know what's happened. Many times, many times they think their kid's been drugged or something, and sometimes they can't wrap their minds around having a kid with schizophrenia at 18. You know, it's very difficult. So we try to help them go through a grief process, basically, about what happened to their child and try to get them through that.
Okay. And so, Bev, there was one other question, and I think now is a good time. What would you say? I'm going to ask two things. For you, what are your challenges in your role? But before that, what are the biggest challenges for the clients and the families? Like, what is the thing that you would say? And that may be one, or it may not be just one thing. It probably is not just one thing.
There's several. One is the lack of insight many people have with psychosis. They think everything they think it is true. And we have to try to educate the parents not to argue with their reality and try to learn how to, empathize, reason, and listen to them. And so they don't alienate their loved one. And also to try to get them the help that they need. There are early intervention programs available through Felton Institute for young people and different resources that we know that we can hook them up with. But lack of insight is a very difficult situation because people won't accept help. They won't request help. So a lot of people end up being 5150 because of that, because their behaviors in the community are, bring them to the attention either of their law enforcement or their parents, or someone else will call because they don't know how else to get them help. The other thing is when people are discharged from the hospital, there seems to be some drop off a lot of times that there's between the hospitalization, stabilization, and then getting services in the community. It always doesn't happen. And then they'll end up back in the hospital pretty frequently.
Okay. And then Bev, for you as a mental health support person, what sort of challenges do you have in terms of like fulfilling your role?
I have a great team of support with PRA. I have the best boss and the best director you could ever ask for. So if I ever need anything, I ask them. I really think that I'm very well supported by my.
Oh yeah, I guess that wasn't a setup to say MHAAC wasn't supporting you. That sounded like it was more, in terms of, but I think you talked about it. It sounds like your challenges come more from client interfacing, the client's challenges and things like that. Okay.
Yeah.
Can I kick something in here?
You sure can.
Absolutely.
Because there's a piece of what Bev does that is so special. And that is the relationships that Bev has built with other parts of the system and with people in mental health administration. She gets some of the really tough cases where the clients are literally falling through the cracks because they're not integrated into the mental health system, and their resistance is making it hard for families to get them integrated. And the relationships that Bev has built with the providers and with the mental health administration allows Bev to reach out and form these bridges and really raise red flags on high intensive cases and prevent tragedies. Much of the time, the work that Bev does literally can prevent tragedies, because as somebody's falling through the cracks, their behavior could cause them to land in jail or hurt themselves or hurt someone else. And the kind of intervention that Bev does with the families sometimes will make that bridge that gap that's just not quite happening and get them started into the treatment system. So I just wanted to highlight that that this is a real special skill that Bev brings to it and has taught the rest of us.
Mm-hmm.
So Patty and I worked on a case together and really saved this young man in Berkeley who had been struggling for many years. She helped me get him transferred over to UCSF Langley Porter, where his doctor is located, but he had lack of insight. He would not accept treatment. So he ended up getting 5150 twice, and he got to Langley Porter, got the treatment he needed, and I must say he's doing much better after Has had schizophrenia since he was 17. He's now 41. So in the last 5 years, he had been having a very difficult time in the community. I must say, I'm very grateful to Patty.
Mhm.
Yeah, I mean, and I think Francesca, this is a good segue because when we all met before to talk about the event, Francesca, you talked about some things that make our organization's PRA program unique. You've been here for quite some time. You've seen an evolution. So I would love for you to talk about that and sort of anything you want to share in regards to that, because I think you hit on that was what my question was going to be. But if you can expand on that and answer that, that would be great.
I'd be happy to. So let me say there are patients' rights advocates in every county. And when I started, we were just Alameda County. And when I first began, I was told, well, your job is to be on the patient's side. And we operated that way, as most patients' rights advocates programs did, as adversaries, as let's go in and find what the facilities are doing wrong and get them in trouble, and let's get people out of the hospital and defend their right to refuse treatment. And and what I noticed over that period of time was that things didn't change. We weren't really making a difference. We were patching up little things here and there, but in general, a lot of the abuses that were happening just continued to happen. The violations continued to happen. Things weren't really changing. So around 2006, we really decided to take a different approach to patients' rights advocacy, which no other program had done. And that was to go to the facilities and say, we're going to stop reporting you to licensing. We're going to come in here and we're going to work with you. We're going to do the oversight that we do, but we're going to come to you with our findings, and we're going to provide solutions and education when we find problems so that we can work together to actually start healing some of the broken parts of the system and provide care that is going to be more compassionate to patients and respectful of their rights, and also make the job of the providers more fulfilling, because it's very frustrating for providers to continually try to provide these services and see people not really responding or being really resistant. And I didn't think that patients' rights advocates should be encouraging this resistance, should be applauding this resistance, because—
Were you at MHAAC when this was happening, Francesca?
Oh,
This
yes.
was
Oh, yes.
incredible.
I was at
This
MHAAC.
was incredible.
Yeah, it really, and what happened was when we first did it, we were pariahs in the patients' rights program. Our colleagues, they wouldn't talk to us for about 5 years. They didn't talk to us. And one time we were in one of the regional PRA patients' rights conferences, and we started talking about the fact that the facilities were calling us and saying, hey, I think we made a mistake. Can you help us fix this mistake? Or we think we may have violated someone's rights. And the other patients' rights advocates said, what? The facilities are calling you and telling you that they may have made mistakes or that there's a violation? How did you do that? And finally we said, well, it's what you guys have been saying we shouldn't be doing. We are partnering with the facilities. And they said, well, but don't the patients feel like you're the enemy if you do that? And I said, I've talked to the consumer community, and the consumer community said they have far more confidence in us since we've had this partnership and collaboration with the facilities, because they believe that when they bring us their problems and we go to the facilities, that the administration and the providers are going to listen to us. And so what I found out was the exact opposite of the fear they had. What was happening in that the consumers were feeling like they were getting better supported because we were working well with their providers. And what we also saw was that the degree of violations, the numbers of violations, reduced dramatically, not a little, but a lot. There were times when no violations, we were finding no violations, because the facilities were calling us and saying, hey, I want to do this, but I want to make sure I do it right. And so we provide this consultative service to a degree that no other program had done, which is pretty much 24/7. We know that the facilities operate 24/7. So they can call me in the middle of the night and say, oh my gosh, I think, we're letting this hold get dropped or something. And what, how should I handle this? And get support rather than have us come in the next day and say, oh, you let this this hold expire, and now we're going to get this person released against medical advice. And so by building these relationships, we can say we've definitely seen improvement in the care, just even in the last year.
Yeah.
Some of the suggestions that we've made to facilities that they've taken, we can go back into the facility now and say, whoa, this is a much more pleasant place to get treatment now.
You know, I just have
think
to
that-
attest to that. I have to attest to that for a minute, because I've worked in my career in 5 of the locked psych units in the Bay Area. All of
Can
them.
I just say one thing really quickly,
Right.
Patty?
Yeah.
I just want to say one thing, and then I was going to toss you, Patty. I want you to say whatever you want to say. I think what Francesca has said, there's a spirit at MHAAC of such care and of such that me as the fund development director and the work that I'm doing is trying to market that, trying to make sure people understand the spirit of which MHAAC does this. And Francesca, thank you, because what you said is transformative. It is something, a narrative that people need to understand and know. And it is something that really is just, it's incredible, because care, the quality of care is changing the standards all around. I'm not a care provider, but I'm a consumer, and I have tons of friends that are consumers, and I know that things have shifted. So I just want to just really highlight that this is critical, what you said, Francesca. And it's just remarkable. So thank you. That's why we're doing events like this, so that more of what this incredible organization and the spirit, people, we can start talking about it, and we can get the money, more money. So Patty, I'm going to toss to you, Patty. Please feel free to respond.
Yeah, I just want to say it's trust. So that the Mental Health Association has developed trust over 30 years with people that have worked there for 30 years, and the new people coming in that are mentored to understand that, you know, first you want the patients to trust you, that you're on your side, you're advocating for them, and to support that, you need the families to trust you. And they do, because, you know, there's 2 things that are really unique. One, and then the facilities trust, because then they'll be transparent. Like, I know anytime there's a messed up rights issue, and I know all the administrators do this from the majority of psych hospitals that you guys work with, they'll say, hey, the hold expired, this person, it's really, really risky. What can we do? You know, what's the process? I mean, people don't call their own legal team, they call patients' rights advocates. And they say, you know, how would you recommend we deal with this in the best interest of the patient? So that's huge. And then the trust, on the other side, for our patients, we know that because we're in effect, we don't want to be a jailer, but we are. Somebody brought somebody here against their will, you know, and depending what's going on with their mental health issues, they might really feel like, no, the meds are going to make me worse. They're not actually going to help clear my thinking. So a lot of times, you know, someone will come in here, they've got some kind of delusions going where they believe something that nobody else believes, and their families will come in and want to talk with them. And they'll say to our clinicians and our social workers, do not let my mother talk to me. She's actually not my mother. She's an imposter. When of course it is really this person's mother, right? And so the mother's out in the lobby heartbroken. We can't talk about the what's going on with the patient. Suddenly our clinicians become the bad guy that are actually, you know, advocating on the inside. And then Bev can bridge the gap, because she can explain, no, the clinicians can receive anything you want to share about what's been going on with your loved one, but they won't be able to talk to you about what's going on with this particular case, because this person has refused to let you have privileges to know what's going on. So there's this beautiful super key buffer, you know, because somebody's out there crying in the lobby because their family member won't let them come in to visit. And then Bev is right there to swoop in and explain, here's how it works. Don't worry, the staff is going to talk your loved one into getting permission. Give it a couple of days while they start to clear. I mean, it's just really it's just a vital role that she not be a paid for member of the hospital, so that she can be seen as a separate advocate. And that's the same with the patient's rights advocates, right? They're not hospital employees. So there's a real separation there where they can say, you know, we disagree with the doctor's perspective, or that we want you to understand this story that the patient is trying to tell you, that the patient can't tell for themselves in this particular. That's a very kind of generic explanation, but so I just feel like trust has been developed with the patients, trust have been developed with facilities and families, and that's credit to this organization.
I just want to jump in really fast, Patty. I just echo all of this sentiment of trust, especially explicitly. I think where patients' rights especially can come in and be the liaison between doctors or clinical staff and clients. A lot of times when I've either directly interviewed or I've watched my team interview, clients are just glad to be heard. All they want to do is have their expressed interest heard and acknowledged in a hearing. And that is something that I think is beautiful that we can offer them. And so there is a lot of trust that comes into this from our clients, from patients' rights and facilities as well. As long as we all continue to work collaboratively, as I know we all will, there are many amazing, great things we can contribute to our community and to our counties.
Well, Sharnice, you answered my question for you, which was why is PRA vital for our communities? And Francesca, I want to write a movie about what you told me. That narrative it's absolutely outstanding. So thank you. We're going to close shortly because this is 45 minutes. But I wanted to give Patty, who's just a powerhouse, I wanted to give you time, Patty. So is there anything you wanted to specifically address or share with your expertise with you being at John George? You were a former board member. I had specific questions, but I do want to open it up for you in case there's something on your heart that you'd like to share or a perspective that you'd like to share.
Well, just that the work that's being done by Mental Health Association is so vital. And I think the thing that they do that most agencies have trouble with is that they honor the voice of the client or peer or patient, whatever the label of the day is. They honor the person who's struggling with mental illnesses themselves. And they have a long history of also honoring and understanding the horror and struggle and just difficulties that go through being the loved one of somebody who has mental illness, so that they're able to honor multiple perspectives that are sometimes in conflict about what's the right thing to do, what's the most helpful thing. And that's the ability to hold both of those truths and really respect both somebody that might be totally anti-meds and say no way that hospitals are not cool, and somebody who might be able to say no, we got to have hospitals to get you stable. They can handle opposing views and yet have the full range of people trying to support healing. They can really support what people need without just digging their heels into one perspective. So I think that makes them special as compared to other places who are only patient advocates or only family advocates or et cetera.
Right. Okay, thank you, Patty. And then we're going to segue to questions from, in case there's any questions, because we do have to wrap it up. But Francesca, I wanted to make sure, is there anything you wanted to share before we segue? I think what you shared was outstanding.
I think there is something that I want to say because there's a little more to the end of that story. And that is that the State Office of Patients' Rights noticed the success that we were having and that our approach was really making a difference and asked us to train advocates from other counties to be, and not just me, but the entire team from Alameda, San Mateo County, because at that time it was just the two of us, to come in and do trainings for advocates from throughout the state. And Orange County actually paid for me to come down there and help them do some revamping of their program. So what ultimately happened was we started to see this grow and some acknowledgement of the fact that it was helpful. And so it earned us a really great reputation and also meant that the good that we were doing, it spread like love spreads,
I think, Francesca, that's the point that I'm making. When we talk about even the fundraising that we're doing, Give Butter, the centrifugal force when things get momentum. And MHAAC seems to be this sort of unsung hero to some degree about extraordinary quality. There's a thing that someone left in the chat about Bev being extraordinary, and I know she has an extraordinary reputation, and it sounds like this work started. And so again, having things like this so that we can give voice to how MHAAC has impacted the mental health sphere now and in the past is critical for creating sustainability. But it's just acknowledging the staff here and the work that you do, which is how we get money for us. So thank you, Francesca. Thank you to everyone here. Really absolutely enlightening for me. Does anyone have any questions before I unpin all of our incredible panelists? Millie, do you have a question?
Well, not a question, but I just have a comment that I think what for me was so effective were the little personal stories and vignettes. I thought Chris really started it off by his sharing, and I know these.
Oh, we're not done yet. We're not done yet, Millie. We're not done yet. You can tell me the end. We're almost done. I didn't know if anyone had any questions for our panelists. If not, we're gonna. I'm gonna unpin everybody, and I know that everyone here is generally. This is a test pilot, but if the panelists want to put their your emails in the chat, that would be great. I'm going to share something quickly just so that we move through our event how we planned on it. Here is, if anyone here needs resources, this is a slide of, depending on which county you're in, you can email for support. And then if any of our panelists put something in their email into the chat, you can email them directly, but I want to leave it on them to do that. And I'm going to toss to the Chris Willmore, our board member who I'm working with on these events, for our close, and then I have a brief thing I want to do. So tossing to you, Chris.
All right. Thank you, Jackie. Well, I'll be really brief. I know we're all excited to get to our weekends. But as a member of the board, I would like to thank all of our speakers today for taking the time this afternoon. But, of course, more importantly, all the wonderful work that you've done and continue to do. From the bottom of my heart, couldn't thank you enough. I want to thank Jackie for putting this session together. It's been a joy working with you. Thank you to Kathy and Francis for your continued leadership of MHAAC. And I also want to thank all of our guests who have taken their time out of their Friday afternoon to join us today to express their interest in the mental health services and how MHAAC is doing their part to help. Thank you, everyone.
Thank you so much, Chris. I'm going to unspotlight you. I have put in the Give Butter fundraiser. If there's new folks here, please feel free to donate. Please feel free to email me if you're interested in volunteering. This is a test pilot. We're going to have another one next month and for another part of our organization, but I was blown away. And again, I just want to reiterate as the fund director who's really marketing so that we can get funds. There's so many things that were said today that need to be communicated more effectively and more known. And that's why we're starting to events so we can understand. I need to acknowledge, Francesca, what you shared with me was extraordinary because that is how grassroots change happens. And as a millennial, I look at this as a grassroots organization that's going in and helping people that don't necessarily get help. And that is really where we want to push the narrative. So thank you for your vulnerability, Bev. Thank you. And Patty, you're extraordinary. Thank you. And Charnice, thank you. I've put that in there. And then I want to give Millie a chance to speak. And again, I want to remind you all, this is the first of these. We are test piloting this. Chris and I are going to probably be doing this every month. We're definitely doing one in September, but it'll be later on. And we want to get more people here. So we need everybody to start inviting more folks for the next round in September. And we'd love to have you all there too. Millie, I want to toss to you in case you had something.
That was just my comment. This was an extraordinary experience, and as I said, I thought in part to people's personal stories and vignettes. So thank you,
Yeah.
everybody.
Thank you, Chris, for your transparency as well. And we're just getting started. Thank you, everyone. Have a great weekend. And my hat is off to our executive director who's steering the ship. We really applaud you. We must acknowledge you and the work that you've done to help modernize and move forward. We all see it, and we have to acknowledge you fully for really, really making stuff happen. Bye, everybody. Thank you.
Thanks, you guys.